Nursing is an art. It is the ability to care with compassion, empathy, and understanding, using not only the heart but also the mind. It involves building trust, showing patience, and being present for patients during their most vulnerable moments. Through kindness and genuine concern, nurses help to promote healing beyond physical treatment. It also means giving comfort, respecting each other's patients' individuality, and creating a safe and supportive environment for healing. In addition, nursing as an art requires sensitivity, patience, emotion, and psychological needs, helping them feel heard, valued, and understood by combining compassion with thoughtful actions. Nurses makes a meaningful difference in their lives of those they care for.
Independent nursing practice involves registered nursing providing care outside traditional hospital setting such as homes, clinics, or community setting. Nurses in independent practice assess patients, create care plans, implement intervention, educate clients, and evaluate outcomes using their professional judgment. They are fully responsible for decision making and patient safety. Nurses must maintain an active license, follow scope of practice laws, and comply with ethical documentation standards. They are accountable for the quality of legality of their care. Independent practice improves access to care, especially in underserved areas. It promotes patient-centered care, preventive health services, and professional growth for nurses. However, it requires strong clinical skills, legal awareness, and the ability to manage administrative responsibilities. In conclusion, independent nursing practice expands the role of nurses, emphasizing both autonomy and accountability in modern healthcare.
Nursing in education involves nurses teaching health knowledge and guiding students and also the community to live healthier lives. Nurses not only work in hospitals but also in schools and communities. Through health education, they teach people how to prevent diseases, practice proper hygiene, and make healthy lifestyle choices. In schools, nurses act as health educators. They teach students about nutrition, mental health, hygiene, and disease prevention. They also provide first aid, identify health problems early, and help keep the learning environment safe. Nursing in education is also important for training future nurses such as us. Nurse educators teach students the knowledge and skills needed to provide safe and effective patient care through both classroom learning and practical training. In conclusion, nursing in education is important because it promotes health awareness, prevents illness, and helps build healthier communities. That's all.
We often think that nurses only work in hospitals. But did you know that nursing goes beyond bedside care? Let's explore the different fields when nurses can work outside the traditional hospital setting. Let's begin with school nurses. As the name implies, school nurses work in schools to promote health and safety. They give first aid, do health screenings, and teach students about hygiene and healthy living to keep everyone safe and well. Next, the community health nursing. This field in nursing focuses on public health rather than individual patients. They work in barangay health centers, rural health units, and outreach programs. They provide immunizations, maternal and childcare, health education, and disease prevention programs. This field focuses on prevention rather than cure.
Occupational health nurses work in companies, factories, and corporate offices. Their job is to ensure employees are healthy and safe at work. They handle workplace injuries, conduct health assessments, and implement wellness programs. They also help prevent work-related illnesses and promote a safe working environment. Military nurses serve members of the armed forces of their families. In the Philippines, nurses can serve under the armed forces of the Philippines. They may work in military hospitals, disaster response teams, and even international peacekeeping missions. This field requires courage, adaptability, and strong clinical skills.
Research nurses support clinical trials and medical studies by collecting data, monitoring patients' responses to treatments, and ensuring ethical standards are followed. Their work, sometimes in partnerships with global organizations, helps improve future healthcare practices and treatments. Nurse educators teach student nurses in colleges and universities. They prepare lesson plans, conduct skills demonstrations, and guide students during clinical duties. They shape the future generation of nurses by sharing their knowledge and experience. Lastly, we have aesthetic and wellness nursing. These nurses work in skin clinics, wellness centers, and aesthetic facilities. They assist in procedures like facial treatments, IV therapy, and skincare management under a physician's supervision. This field is growing rapidly as more people focus on beauty and wellness. In conclusion, nursing is a diverse and flexible profession. Nurses are not limited to hospitals, in which they can also work in schools, communities, companies, the military, research institutions, and many more fields. Nursing is not just a job, but a profession full of opportunities to serve in many different ways.
Nursing is called an art because it is more than just giving medicine or following medical instruction. It is about caring for a person in a deeply human way. While nurses use science to understand the body and treat illness, they also use compassion, patience, and understanding to care for the person behind the illness. Every patient is some different. Some need encouragement, some need comfort, and some simply need someone to listen. Knowing how to respond to each person's emotions, fears, and needs cannot be learned from a textbook alone. It requires empathy and heart. Nursing becomes an art in a small, meaningful moments. Be speaking gently to someone who is afraid, holding a hand during a painful procedure, explaining a condition in a way that brings comfort instead of confusion, or simply being present when someone feels alone. So this action may seem simple, but they can bring great comfort and healing. In this way, nursing is not only about treating disease. It is about caring for the whole person, body, mind, and spirit. That human touch is what makes nursing truly an art.
Nursing is both a science and an art. The science of nursing focuses on clinical knowledge, technical skills, and evidence-based practice, such as administering medications and performing procedures safely. However, nursing goes beyond tasks. The art of nursing is the compassionate side of care. It involves empathy, presence, therapeutic communication, and genuine concern for patients. This idea was influenced by Florence Nightingale, who believed that healing requires not only treatment but also a caring environment. Caring and active listening help reduce anxiety and build trust, showing that nursing is rooted in meaningful human connection.
The art of nursing also emphasizes holistic care, treating the patient as a whole person, physically, emotionally, socially, and spiritually. According to the World Health Organization, health is complete physical, mental, and social well-being, not just the absence of disease. In the Philippines, ethical nursing practice is regulated by the Professional Regulation Commission to ensure quality care. In conclusion, while science provides the skills, art provides compassion. A nurse does not only treat illness, but a nurse listens, comforts, and cares.
Caring is an integral part of nursing because it forms the heart of every interaction between a nurse and a patient. In nursing practice, caring goes beyond giving medication or performing medical procedures. It means showing compassion, empathy, and respect and understanding towards every individual. A caring nurse listens to a patient's concerns, comforts them during difficult moments, and supports them physically, emotionally, and mentally. Through caring actions, nurses help patients feel safe, valued, and understood, which can greatly improve their healing and overall well-being. Therefore, caring is not just a skill in nursing, it is a commitment to serve others with kindness, dedication, and humanity.